Jackson County public health officials met this morning to provide direction to schools and healthcare providers after a local high school student came down with the mumps. NBC5 News broke the story of the illness last night.
The student was vaccinated, but tonight we're learning just how effective the vaccination is and what you can do to make sure you're protected.
Look at vaccine history and make sure that you're up to date.
Medical Director Dr. Jim Shames says the presumptive case of mumps in Jackson County marks the 10th such diagnosis in our region since December.
What we're currently seeing are clusters of mumps cases recently in wrestlers who've been in tournaments. And I think the majority of those cases have been immunized kids.
That was the case for Cassidy Borman, a 14-year-old who likely contracted the virus after participating in a tournament in Northern California. She was up to date on her immunizations, but still got sick. Dr. Shames says that's not unheard of.
Vaccines are not 100%.
For example, the vaccine for measles has an effectiveness of about 96 to 97%. The mumps vaccine, about 88%. And the flu, about 50%.
It stands to reason that if you get some mumps cases, many of those, even sometimes the majority of those, will be in people that are immunized.
The virus is spread by mucus and causes inflammation of organs.
Pancreas, testicles, ovaries, brain tissue, parotid glands.
And while there's no treatment, there are things you can do to protect yourself and others.
People who are sick should stay home. Make sure you're fully immunized. Adults who've had one vaccine should have a second. School-age children should have two. And cover your cough, wash your hands frequently, that sort of thing.
Dr. Shames says they have been seeing a downward trend in people getting vaccinated. He adds it's more common to see outbreaks of vaccine-preventable illnesses in communities that don't get immunized.